Good day everyone, my name is Emerose Aidolo, a BS Nursing 1B student from University of Eastern Philippines handled by clinical instructor Johnny Dichan, school year 2021 to 2022. And for today's video, I will be showing you how to properly assess the breast and the lymphatic system of our patient. But before I start with that, allow me to give you an introduction to what materials I am going to use. So first, I have here a gloves to use it for the client's hands out on breast. Next is the centimeter ruler, a small pillow, and slide for a specimen. So as you can see that my equipments are complete, let's get started. So now I am going to assess the patient. So good afternoon, ma'am.
Good afternoon.
So my name is Emerose from University of Eastern Philippines, and I'm your nurse student for today. So for verification po, ma'am, no, may I ask your name?
My name is Celestina Gonzaga.
Okay, Celestina Gonzaga. What about your birthday?
My birthday is on May 9, 1997.
What about your age?
Turning 27, so I'm 26.
So ma'am, which language do you prefer na?
English and Tagalog.
English and Tagalog. Okay, so just to note that. Okay, so rest assured lang po ma'am, no, that all documents na manunoted dito sa ating findings and ay confidential between me and other physician that I'll be referring to you. So is it okay with you?
Yes.
Okay, let's start with you to questioning. So first, may I ask if there is a changes in your breast?
No.
Any lumps or swelling?
I didn't see any.
What about redness on your breast?
Wala na.
In warmth, dimpling or the size of your breast?
Okay naman siya.
Okay. In firmness, or do you feel any pain or discharge of your breast?
Wala.
Okay, wala. Okay, what about in past history, previous problems with your breast? Napa-treatment ka na ba? Or napa-surgery?
Wala.
Okay. What about in age at menses?
Ano?
Age at menses po?
Ano? 12 years old ata.
Okay, 12 years old. So, what about in first, last day of menstrual cycle?
April 3 hanggang April 7. Hindi pa naman ako antinated.
Okay, so next, what about in family history? Do you have a family history in breast cancer?
Wala na lang ako nakakala.
In lifestyle and health practices, do you use a hormones? Do you use a contraceptives or antidepressants?
Wala.
Okay. What about exposure to a radiation?
Wala.
Exposed ka na ba? Okay, wala. Usual diet, ma'am, including taking alcohol. Do you take an alcohol?
No, I don't feel.
Okay. What about in soft drinks and chocolates?
Hindi na ako mag-iwas.
Okay, hindi ka rin.
Sensitive yun.
Okay.
So,
What about in your usual exercise pattern, ma'am?
Yung sabay lang ako nag-get.
Okay. What about type of your bra during exercise you worn? Okay, sports bra. Nagpa-examine na po ba kayo sa physician on your breast?
No.
Okay. Okay, ma'am. So I'm done questioning you. So next, I will be gathering equipment and assessing a breast. So first, we have here a centimeter ruler, a pillow, a glass of the specimen, next, a gloves later to use on palpating your breast. And next is alcohol to sanitize my hands. So now I will close the curtain for the privacy. Okay, I already closed the curtain for the privacy of the patient, and make sure that doing this breast examination, make sure that there is someone with the nurse. So here's the patient's mother to guide para magbantay. So next, for today, ma'am, no, I'll just explaining you the procedure that I'll be doing to you later. I'll be assessing your breast and lymphatic for me able to assess, and I'll be able to touch the certain part of your body, specifically on your breast, and you need to take off later your shirt and bra. So is it okay with you?
Yes.
Okay, so ma'am, no, later on, I will touch your breast to check for your circulatory and respiratory system to find any abnormalities with your breast. So before we start, ma'am, no, can you wear a lab gown? Okay. So first, we have to inspect the breast. So ma'am, can you lower your lab gown into your waist? Okay. Okay, so my patient is in the sitting position. So here, ma'am, I'm here to inspect the breast. So I'm looking for the shape, the size, and the symmetry. So, okay. Okay, so I observed that I can see that the breast is normally larger than the other, and that is normal and is symmetrical. So, ma'am, may I ask na, ganyan na po ba yan kalaki yung ano nyo? Okay, so next, I'll be inspecting the color and the texture. Okay. Okay, so I can see that the color of the skin is light brown, and I can see that the texture is smooth, and I didn't see any edema. Also, there is no scar. Okay. So next, I'll be inspecting for the areolas. So, okay. I can see that the areola is normally round or oval, equal in size. It is also light brown in your nipple. So next, I'll be inspecting your nipples. So we must look for the size and the direction of the nipples of both breasts. And I'm looking if there is a dryness, a lesion, or discharge, which is not. So the nipples are nearly equal bilaterally in size, are in the same location of each breast, as you can see. And I observe that the nipples are everted, and there is no discharge that presented on your nipples. So next, I am going to inspect for the retraction and dimpling. So in here, we have 6 different kinds of position while inspecting the breast. So ma'am, can you raise your both arms overhead? Like this, ma'am. Okay. Okay. Can you put down there? So I observed, ma'am, no, that your breast is a conical or a shaped cone, and it is symmetrical. Next, can you do a sitting arm side of your hand like this? Okay, I'm looking at the shape, the size, and the symmetry of there is a lesion ba or discharge or retraction. Okay. Okay, so I observe that there is no lesion, discharge, dimpling, or retraction, and it is a symmetry. So next, can you do sitting hands on your hips like this? Okay, so you observe that there is no lesion and redness, and there is no edema. So next, can you lower your hand? So next, can you do a supine position? And I will use a pillow to support your shoulder. So can you do a supine position now? Wait. Okay. Okay, so I observed no that there is no dimpling or retraction. Okay. Okay, ma'am, can you do a sitting position? Thank you. Just okay, and look here, the side. Okay, so next position, can you press your hands together with the finger on one hand pointing opposite of the fingers on your hand like this. Okay. Okay. Can you open like that? Okay. So I observe that while you're doing that, okay, can you go back your hands? So while doing that, no, I observe that your breast is symmetrically and there is no sign of like dimpling or retraction, which is good to know. So, and for the last inspecting, ma'am, no, can you lean forward from the waist like this po. Okay. And lean forward. Okay. I'm just inspecting for the. Okay, so, ma'am, so I observe no while doing that. I observe that your breast is symmetrically. There is no sign. There is no dimpling of retraction, and which is good to know. Also, your breast is symmetrical and it is normal. So next, can you wear again your lab gown? So next, I'll be palpating the breast of my patient. So ma'am, can you is it okay with you to touch your breast? Okay, so can you lie down and okay, lie down is supine position. Okay, wait lang ma'am. So first, we have to palpate the texture and the elasticity. So, can you do that now? Yeah. So I'll just palpate the breast. There's okay. You have to palpate the texture and the elasticity. Okay. On the other side. Huh? Okay. So, okay, so while palpating for the elasticity in the texture, I observed that it reveals a smooth, firm, and it has a elastic of her tissue. So next, we have to palpate if there is a tenderness and temperature. So, okay, I'm just palpating if there is a tenderness. So, ma'am, do you feel pain? No. on the other side. Okay, the temperature. Okay, so I observed that her breast is normal and her temperature also is normal. So next we have to palpate for the masses. So I have to palpate the masses of her breast. Okay, the other side. So we have to look the size and the centimeter. So we must use a centimeter. Okay. Okay. Size in the centimeters, the shape, also the mobility, the consistency, the tenderness. Also, we have to note the condition of the skin over the masses. So, I observed that there is no masses and inflammatory transverse rig are normally well palpating at the lower base of her breast. So, if you detect any lumps, we must refer to the client for the further evaluation. So next, I am going to palpate the nipple. So first, I am going to sanitize my hand and I'm going to use a gloves. Okay. So here. So next, I'm going to touch the nipples to compress gently with my thumb using my index fingers and my thumb. So, okay, I'm just pressing the nipple of my patient. Okay. On the other side. Okay, so I observe that the nipple become erect and the areola have a pucker response to stimulation. So next, I am going to palpate the mastectomy or the lumpectomy site. Okay. 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 So, on the other side. Okay, so if the client has had a mastectomy or the lumpectomy, is it still important to perform through the examination? So, and I'm palpating if the patient has a scar. So, as I can see that my patient has no scar and I don't need to palpate her already. So I observe that there is no scar, and there is no redness or swelling. Also, there is no lesions or tenderness on her nipple. So next, I'll be inspecting and palpating the axillae. Next, we have to inspect the axillary skin if there is a rashes or any infection. So first, we have to hold the client's elbow with their hand to support. Then I am going to use a fingertip tips pads of my hand to palpate the axillae of the nose. So firmly the axillary of the lymph node. So first we have to palpate high into the axillae. moving downward against the ribs to feel for the central nodes. Okay. I'll just move down the posterior axillate to feel for the posterior nodes. Okay. On the other side. Okay, on the posterior, down. Okay. So I observed I observed that I didn't feel any abnormalities. So next and last thing to do, I'll just palpate your breast using my finger pan. So is it okay with you, ma'am, to do a vertical strip for the palpation of the breast? Okay. So I'll just use my fingertips. Okay. Use the fingertips. So be sure to palpate every square inch for the breast from the nipple and the areola to the periphery of the breast tissue and up to the tail of that. Inspect me. And the other side. Okay, so we have here, I'm done palpating the first vertical strip. So next we have to palpate the axilla and the clavicular node. So first we have to palpate the supraclavicular nodes. Okay. First we have to palpate the supraclavicular above the clavicle, and we must look for the size, the shape, the mobility, the tenderness. Do you feel painful, mama? And the consistency. Okay, next we have to palpate the infraclavicular nodes. We must gently palpate below the clavicle. Next, we have to palpate the inclavicular nodes, which is here on the armpit. Okay. Just gently. We must palpate the central nodes. Okay. Next, in the lateral nodes, we must gently palpate the inner aspect of the arm. Also, we have to palpate the lateral nodes. Lateral nodes, okay. The lateral nodes. Next, the posterior nodes, which is here. Okay. Next is the pectoral nodes. We must palpate in arterial nodes. Okay, next the epitrochlear nodes here at the elbow. So okay, same as on the other side. So ma'am, I'm done. Can you wear blood count. Okay. So now I am going to document all I observed in first examination. So I'll get my record and document all the So I'm done inspecting and palpating the breast of the patient. And last, I am going to formulate a diagnosis. So thank you, ma'am, for your cooperation. Thank you. So a nursing diagnosis is a short and it has a three-part of statement that forms the basis of a nursing care plan. Drafting the hypothetical nursing care plans is a critical thinking, unlike a medical diagnosis or medical condition. A nursing diagnosis analyzes the patient's needs. So first and foremost, we have to collect and analyze the data. We must observe the patient's symptoms, talk to the patient and their loved ones about how they're feeling, and then we have to evaluate the patient's response to their symptoms. We have to distinguish between the objective and subjective data, and then we have to identify the problem that your nursing diagnosis will address. So next, I am going to check the patient referral form. So in today's date is, okay. So the referred language of my patient is English and Tagalog. So in referring patient information, so the name of my client is Celestina Gonzaga. Name of her birth is May 9, 1997. Her age is 26. Her address, her zip code and contact number are confidential. Same as her mother. So next in reason for referral, so Miss Celestine Gonzaga was referred for the breast and lymphatic system performed by nurse me, Emmy Rose Dolo, to evaluate and to observe if there are any problems, abnormalities, or condition that Miss Gonzaga is experiencing. So asking some relevant questions to elicit the information and timely insight into the health records of Miss Celestina, and can point out to some early symptoms or identify certain condition that may require early attention. Hence, I, the assigned nurse, would better understand that Miss Gonzaga's overall evaluation. So we have here the health summary of the subjective or the actual diagnosis. So the client said that she do not notice any changes in her breast, right, ma'am? Also, the client said that there is no lumps, swelling, redness, or warmth, dimpling, size, firmness, pain, or discharge. Right, ma'am?
Yes.
So my patient's breast is okay and I didn't feel any pain. So here in the subjective or the risk diagnosis, the client said that she has no previous problem with her breast and did not undergo or receive a surgery or treatment. And clearly to say that the patient said that she started having a mens or menses at the age of 12, right, ma'am? Okay, so my client said also that she did not give birth. Also, my client said that her menstrual cycle started from April 3 up to April 7, right, ma'am?
Yes.
Also, my client said has no risk for problems in breast cancer. So next in the wellness diagnosis, my clients do eat a healthy food. Also, my client never drink alcohol, coffee, any kind of beverages, and chocolate, right, ma'am? Okay. So my client also said has My client also has a readiness to stay fit and healthy, uses a light exercise 2 times a week, and she uses a sports bra doing in her exercises. Also, my client did not examine the pregnancy of breast sometimes. Also, my client said that she did go or examine her breast with the physician. So next in wellness diagnosis, my client do it's a healthy food. Also, my clients never drink any kind of beverages. Also, a chocolate, right, ma'am?
Yes.
Also, my client has a readiness to stay fit and healthy. Also uses a light exercise. She exercise twice a week. She also use a sports bra in doing her exercise, right, ma'am? Okay, so my client did not examine any frequency of her breast sometimes. And my client said that she did go or examine her breast with the physician. Okay, so next part is we have to identify the related factors. So first, we have to find the sources of the patient's problem. Next, we have to evaluate the patient's history and overall the health. Third, we have to include the potential problems when determining the related factors. So here is the patient's mother, Mrs. Olga Madrigal. So good afternoon, ma'am.
Good afternoon.
So ma'am, as you can see, may I ask that your daughter has no a previous problem with her breast and did not undergo or receive any surgery or treatment?
So far naman, wala.
Okay. Clearly to say that, ma'am, no, that your daughter said that she started having or menses at the age of 12.
Yes.
Okay. Also, your daughter said she did not give birth, right, ma'am po?
Yes po.
Also, your daughter has no risk for any problems in breast cancer in your family history.
Opo, wala naman po kami family history ng breast cancer.
Okay. Wala naman. So, thank you, ma'am.
Thank you.
Okay, so in third part in making diagnosis is make a clinical judgment. So first we have to step is to find the most appropriate nursing diagnosis. Next, we have to combine the related factors for your diagnosis. And then third, we have to summarize the data. So the overall diagnosis here, so I can see that her breast is normally larger than the other, and that is normal. And it is symmetry, so that my patient's breast is in a normal growth. Also, my patient's color in breast is skin tone, and I can see that the texture is smooth, and I didn't see any edema. Also, there is no scar in her breast. So the areola of my patient is normally round or oval, moist, equal size. It also the color of her nipple is light brown. So next, the nipples of my patient's breast are nearly equal, which is not bilaterally in size, are in the same location on each breast, and I observe that the nipples are everted and there is no discharge that presented on her nipples. Also, I observe that the breast is conical or shape of a cone, and it is asymmetrical. Also, I observe that there is no lesion or any discharge, dimpling, or retracture, and it is symmetry. Also, I've observed that there is no lesion or any redness or edema. Also, I observed that her breast is symmetrically with no sign of dimpling or retraction, and which is it is good to know, no? So I can see that the breast is symmetrical and that is normal. So while I palpating, so no, it reveals a smooth, firm, and it has a elastic tissue. Also, there is no pain or tenderness that my patient is feeling while I am palpating. So it is normal, and her breast is a normal temperature. So also I observe that there is no masses and a firm of in her inframammary transverse rig are normally while palpating at the lower base of her breast. So also the nipple of my patients become erect and the areola have a pucker to respond to stimulation. Also, I observe that there is no scar, there is no redness or swelling. Also, there is no lesion or tenderness. So, while I'm inspecting the axillary skin of my patient, there has no presentation of like rashes or any infection. So, I observed that I didn't feel any abnormalities while I'm inspecting her. So, while palpating her, I'm just looking for the size, the shape or the tenderness, and the mobility and the consistency of my patient clavicle that are normal based on my assessment. And last, the lymph nodes are in good condition and there is no lesions or lumps. So I'm done for my overall diagnosis. And last, for the referred by for the health provider name, which is me, Nurse M. Rose Dolo, especially in signature, which is important. I will include my address and my contact number, which is confidential. So I'm done assessing her breast and the lymphatic in examination. So thank you, ma'am, for your cooperation.
Thank you.
Thank you.